Alrighty, are we live?
Yeah, I think we're live. All right.
All right, everybody, welcome to this live presentation of getting healthier with metabolic wellness from this group tonight. Everybody knows me and Dr. Aiken, so this will be our second week of doing this live event. We're going to start doing this weekly. So just wanted to start off this week doing a series about the protocol of feeling great system every day. So I'm going to go ahead and give this to Dr. Aiken and go ahead and get started.
All right. So tonight I was going to talk about something, about really what people don't want to think about, which is what's the end result if you sort of neglect your health for a long period of time. And the reason why most people don't care, where they don't think, there's a statistic out there that the vast majority of people have to have some kind of a health scare before they're going to change their behavior, because it just doesn't seem real to them until then. Then there's always the remorse, the regret. Why didn't I do things differently? I wish I'd done things differently. Would have been so easy, and all this. And it seems easy after the fact, once you've got, a doctor with a catheter going up your artery with it and putting a stent into your coronary after you nearly died and they had to resuscitate you. But all the days leading up to that day, what happened? Why doesn't anybody ever feel like making any change? And so we actually have a name for it, like the psychological term. They call it hyperbolic discounting. Nobody cares about future rewards. They care about immediate rewards. And in fact, we prove that this doesn't work, that future rewards don't work, with a campaign that the federal government, I believe, funded for a while, where it was sort of this idea of food is medicine, and take care of yourself today so that you can have a better tomorrow. And they spent all this money on it, and it didn't really change anything at all, because nobody cares about future rewards. And so what you have to do is realize that there is an immediate injury that's happening, and it's called end organ damage. And so a lot of people, they don't get this concept until after the fact, where there's a problem. And so to explain end organ damage, every day that you're alive, your kidney, your vital organs. So there's four main organs that you got to have to live, without which you're dead. And I'm talking about visceral organs, as opposed to your external organs like your skin. Obviously, you got to have your skin or you die. But visceral organs, that's the ones on the inside of you. That's liver, heart, lungs, brain. In medical school, we used to say liver, heart, lungs, brain. Only these must remain. If in doubt, cut it out. So the deal is that you've got to have those things. You can live without your kidneys. That's why we have dialysis. But it's not great living without your kidneys. But you must have liver, heart, lungs, and brain. And so without those things, and here's the thing, is when you're eating in a way that's not in your best interest, then all four of those are taking end organ damage, accelerated end organ damage. So that's that little bitty hit that your brain takes every day. Your heart takes a hit every day. And probably the only one that doesn't take a major hit out of all of those is your lungs. But the liver does, for sure, heart does, and brain does. So, how do you make this a reality? How do I, shock you into it? And when you look at the warnings for tobacco use, they found that there's not a dramatic influence on people with those warnings. In fact, some people with just the warning may actually use tobacco more, depending on their personality type. People that don't like to be told what to do, or sort of oppositional, defiant personalities. But then if you combine the warning with a graphic picture, though, oftentimes it does do better. it changes behavior. I want to show you a few things if I can. If I can share my screen on here, I'm going to try to do this. Let me try to share my screen. And James, I don't know if I can do it or not, but I'm going to try. There it is. Yes. Okay. It's there. All right. So I'm going to just show you, by the way, here's me, 2016. Dad bod going, nice belly there, nice double chin. And then here is me, just this is a few months. I was right at this weight in I guess it was 2022. And then this is where I was like within 4 months after being on the regimen that James and I have been talking about. I've been talking about this product now for over 2 years, and here it is right here. And it's simple, it's easy, it's completely natural, it has no side effects. And they'll even give you your money back if you don't like it. But I've been talking about it for 2 years, and now I'm just going to live on it forever because it's just that great. That said, let me sort of get you into some of the harsh realities here of what happens when you just continually eat too much sugar, too much. Here, let me get past this. Too much refined carbs, the muffins, the bread, and all the other. Let me get past this. I'm going to get you to some. All right, here's some of it. Okay, this is the hair loss pattern, first of all. And you're not getting you may not necessarily be tremendously sick when this starts. This is a woman, by the way, and this is not a man, woman. The hair loss on the crown of the head here is very common with insulin resistance. This is what metabolically sick person who's just been eating too much sugar, too much carbs, and really not, and letting their insulin resistance run wild. Skin tags are a very common finding. If you see somebody with these things on their neck, it's almost certain that they are diabetic. Just ask them. You have diabetes? They'll wonder how you knew. And it's because insulin, when you have high levels of insulin running around in your bloodstream, which is what ends up happening when you become diabetic, you have high levels of insulin, type 2 diabetes. And insulin makes things grow, like skin tags. Then you start getting discoloration of the skin in characteristic areas around the skin folds, like in the neck, the groin, so forth. This is called acanthosis nigrans. And by the way, this is a white person here. But you start to see this dark discoloration at the neck and then the skin folds. I'm going to show you something else. All right, now let's talk about the really serious stuff. Now that's just the superficial things, okay? Let's get into the serious stuff. Stroke. So insulin resistance is probably the #1 cause of strokes. It's the main driver of strokes, and strokes are the second most common cause of death in the world. So the big problem here. So this is a brain scan. This is a CT of the head. And if you ever wanted to know the difference between CT and an MRI, think of CT as like an X-ray. It's the same technology, essentially. An MRI is totally different. It's working off of a different pathway. But the skull is always white on a CT scan. And this big dark area right here, if you can see this, that is a stroked out part of the brain. Now look at this, it's almost a quarter of the brain. And notice, see this little line here? That little line is supposed to be in the middle where this line is, but it's shoved over that way because of all this brain is swelling. The brain here has died, it lost its blood supply, and then the cells died, and because they died, they start absorbing water around them, what we call cytotoxic edema, swelling, and then it starts pushing the brain over to the other side. So you're getting a serious situation. We call this malignant middle cerebral artery syndrome. They stroke out a major artery, and then what we end up doing, this is my neck of the woods, is we end up doing a big craniotomy here. Now this is graphic, but this is the harsh reality. This is what happens. You end up eating too much sugar and carbs, you wind up with this stroke, and then we end up having to open your head to allow the brain to swell out. It's got to have room. You think of the skull as a closed box. This is a hard box. If this starts swelling, the pressure goes up inside your head. If it gets too high, you die. So in order to keep the pressure down, we cut into the bone here in the front and in the back, take all this bone off to allow the brain to swell out and keep the pressure low. So this is what it looks like. And it's a swollen brain here. And then we just leave some kind of a artificial covering over the brain, then suture the skin closed, leaving the bone flap out. Okay. So this is what it looks like after surgery. See all the dead area of the brain has swollen out of the skull there. And these little dark circles here are a little bit of air that got in when the surgery. It's no injury, but just so you know. So this is what they look like a few months afterwards. Okay, big sunken in area of the skull, because eventually the swelling goes down. That part of the brain that died also just dissolves away, and then it's sunken in like this. And then we go back in 6 months later, 3 months later, whatever, and replace the skull flap once the swelling has gone back down, if they survived it. Here's a dark foot. This is a cold foot. So blood vessel gets clogged going to the foot. They come in, blue foot. They can't, it hurts tremendously bad. It's cold. There's no pulse. They end up having to have an amputation, partial amputation or whole amputation, depending if it doesn't work out. This is a partial amputation. And again, all this is preventable. You don't have to go down this path. But if you keep taking that little hit every day, you never learn to change the behavior, then you end up taking a big hit here. My father ended up with this operation. Partial foot amputation. Here's a bowel. Okay, now look, this is the way normal bowels should look. Pink, red, reddish pink. This is healthy until you get about here. And then it's black. So this is an infarction of the bowels. Think of it as like a stroke in your bowels. So what they end up having to do is cut this section out. If they don't catch it early enough, and this dead bowel here breaks open, because it becomes, once it dies, it becomes very fragile, and then the feces on the inside leaks into your peritoneal sac, and now you get septic. Now you're in a life-threatening situation. You can die from that. Those bacteria go into your bloodstream. They cause your blood vessels to widely dilate open. Your blood pressure drops out. Your heart eventually can't compensate. You're in trouble. If you got a weak heart to begin with, you're out of there. Another area of my neck of the woods here, this is spine problems. Now, this is a normal MRI here. Notice the clean disc spaces. This is a plain x-ray of the neck. Clean disc spaces, normal alignment. Now look at this. You have this molten lava bone on the front that's just sort of fused all these bones together, autofusion. And bone spurs all over the place. They call this diffuse idiopathic skeletal hyperostosis. This is all diabetes here. This is the effect of diabetes and insulin resistance. You don't have to have diabetes to get this part. You just have to be insulin resistant. So you start getting neck pain, losing neck mobility, but it happens in other parts of your spine. But I see a lot of diabetic patients in my spine clinic. So liver problems, of course. The sugar only gets processed in the liver, in particular the fructose part of sugar. Sugar is composed of two things, glucose and fructose. Every bit of the fructose goes to the liver, and it can only be processed there. The glucose can be processed anywhere almost. It goes into the fat cells, it goes into the muscle, it goes into your brain cells. But fructose, when you're drinking a lot of high fructose corn syrup, all of that has to go to your liver. And once the liver gets overloaded with fructose, what it does is it turns that fructose into fat. And then before too long, you got a fatty liver. And then you're starting to have oil spills. Too much fat in the liver turns into an oil spill in your liver, and that causes inflammation of the liver. You got hepatitis. So any itis means inflammation. And if that inflammation goes on too long, hepatitis progresses too long, You eventually get cirrhosis of the liver, and I'm sure you've all heard of that. You mostly hear about it with regard to alcoholics. When you think cirrhosis, you think alcoholism. No, not anymore. Most of cirrhosis is caused by, most of cirrhosis is caused nowadays by insulin resistance. Okay. So for some reason we're having a little technical difficulty, James. I'm going to finish the live here. You're stuck with me till the end. Let me just pull some other stuff here that I want you to see. Here's the situation with insulin resistance, all of the things that it causes. Let's go through these just real quickly. So cardiovascular disease is the number one killer. Heart disease has always been the number one killer in recent times. It wasn't always that way. In the old days, like when I say old days, I mean over 1,000 years ago, the big three things that killed people was, number one was famine, not having enough food. Number two was trauma, war, trauma. Number three was infectious disease. Those were the big three killers. Not enough food to eat, trauma, and infections. Nowadays, it's heart disease. It's from too much food, basically. Too much food is killing us more than anything else now. And so too much food causes heart disease. Too much food causes diabetes. Too much food causes non-alcoholic fatty liver disease, which is now the number one type of liver disease. And in fact, probably around 45% of American adults have some degree of fatty liver disease. Most of them don't even know it. Polycystic ovarian syndrome and all of the baggage that comes with it, the infertility and the discomfort, the hormonal problems, weight gain, cognitive decline. Alzheimer's is really strongly connected with insulin resistance. They now call Alzheimer's diabetes type 3. But you don't have to have diabetes to get Alzheimer's. All you got to have is insulin resistance, and you will elevate your chances of getting Alzheimer's. Inflammation and joint pain. I just showed you the neck x-rays of the people who have insulin resistance and diabetes. They have bad spines. Sleep apnea. Whenever you get overweight, you get sleep apnea. A lot of people do. And sleep apnea is like one of these silent killers. It causes problems with your heart, actually, and it can cause pulmonary hypertension. So it's high blood pressure in the arteries going to your lungs, which is a terrible death eventually. You can get right heart failure from it. Kidney disease, that's probably in the top 10 killers. Cancer, depression, ain't nobody got time for that right there. Infertility, skin problems, I just showed you those. Gout is another big issue that occurs with insulin resistance. And it's mostly because the hyperconcentration of uric acid that occurs because of too much insulin in your bloodstream. Gastrointestinal problems, and hair loss. So here's the deal. It's like, how do we treat diabetes? When they get really bad, first we start them off on medicines like metformin, just try to treat it with medicine. Jardiance is another one. We've got a few other of these, what we call hypoglycemic agents, glyburide. We're trying to just basically, they work by different methods trying to get the sugar out of your blood, okay? In my opinion, metformin is the one drug that works most like you would want a drug to work. Jardiance, what it does is it makes the sugar exit through your kidneys, okay? It's like taking a back door through your kidneys and letting it go through there. But the problem with that is once you got all this sugar in your urine, it makes your urinary tract vulnerable to infections. Bacteria love sugar. So you start dumping all this sugar through your urine, and that's one of the side effects of this drug is increased frequency of urinary tract infections. With each urinary tract infection, you may be taking a hit to your kidneys. And you don't have to have your kidneys to live, but man, life isn't good without them. I'll tell you that. So what you want is for that sugar to go into all of your cells like it's supposed to, and just be used up. That's the ideal way. Metformin is the one that works closest to that. But our product here, this product here, is totally natural. This little packet, what's in here, Unimate, is like a natural metformin. It makes your cells more sensitive to insulin again. It helps to reverse that insulin resistance. And now you don't have to take metformin. You don't have to take Jardiance. You don't have to take insulin. That's the kicker. See, insulin is what we treat the end-stage diabetics with. Once the medicine won't do it, then we put them on insulin. And insulin is the problem. Insulin resistance makes you have high insulin levels, which is what causes all these diseases here that I just showed you. You don't want more insulin in your bloodstream. You want less. You want very little amounts of insulin, as little as possible. That still gets the job done. And everybody that goes on insulin for diabetes gains weight. It makes you gain weight, period. It's almost impossible to lose weight when you have to take insulin injections. Hey, Donna, how are you? So that's the deal. You want as little insulin in your body as possible. And then things start getting better. The only way to get insulin levels low is to stop eating things that require a lot of insulin. So let me explain that right there. Let's go to that part. Let's talk about that. What makes insulin levels go high? Let me get out of this version of it. Let me find it on here. Okay, let's talk about that. All right, yeah, let me show you this. Right here is the wheat grain. On the outside of the wheat grain is this chaff. That's the fiber. And that's exactly what they remove. And they keep this part here, the endosperm. That's what they make the bread with. That's what they make the muffins with. That's flour. This is flour, cake, right there. So if you remove the fiber on the outside, they're supposed to be together. Then whenever you consume the endosperm by itself, all that hits your bloodstream very fast, raises your insulin levels very fast. When your cells keep repeatedly getting exposure to high levels of insulin because you're eating this carbohydrate without the accompanying fiber, then you start to eventually become insulin resistant. And it can just take a few weeks. It doesn't take long. This isn't like a multi-year thing. Simply eating a few weeks worth of sugar and carbs, a lot of sugar and carbs, will put you into insulin resistance faster than you realize. You're not necessarily diabetic at that point, but you got high insulin levels. Now your heart and your liver and your brain are taking the hits every day. By the way, the germ part is where all the nutrients are, okay? The vitamins, the minerals, and they extract that too. And then they put it back in. They get big pharma. They buy when they say something is, enriched bread, nutrient enriched, fortified, they're buying those nutrients back from big pharma that were extracted in the refinement process here. So what you want is to eat the endosperm with the chaff together. Think of it as like a time-release carbohydrate. Slowly, the carbohydrate goes into the bloodstream, which keeps your insulin levels low. So that's where this packet comes in. The first packet makes your cells sensitive to insulin again and helps you to lower those insulin levels so your body can finally let go of the fat. And it also helps kill the sugar and carb cravings. And then this also helps relieve the sugar and carb cravings. This is called Balance. And what this does is it's a bunch of fiber. So you drink this right before your meal, and it's like putting the chaff back in with the carbohydrate again. Most people aren't getting enough fiber. Most people are eating like 15 grams of fiber, and most people should be eating around 30, so almost double that. And so this has some fiber in it, but also has some polysaccharide mix in there. That is the magic, that mixture of polysaccharides with fiber together. Polysaccharides are kind of like fiber. They're a little different. They are partially digestible, but they help, again, to keep the insulin levels low, which is exactly what you want. It's a metabolic healing of this product. So the carbs provoke most of the insulin response. Insulin, not as much. Fat, at the very least. You eat a handful of nuts, it hardly puts a dent in your blood glucose level. It's like I think the glycemic index, which is a measure of how high a food raises your blood sugar. I think the glycemic index of a handful of almonds is like 15 or 20. It's very low. So that's not going to raise your blood sugar or your insulin levels very fast, or your blood sugar, even though there's carbohydrates in nuts, but there's a lot of fiber in there. So it just doesn't get to your bloodstream a lot, that much, that fast. So I don't know how long I've been talking at this point. I don't have a clamp on the time here, but about almost 30 minutes here. Let me see it here. I'm going to show you this before I finish up. This is a model. Let me go back to one here. Let me go to the previous one. Okay, let's watch this. This is the pancreas here. Whenever you eat those sugar and carbs, okay, the pancreas is going to put the insulin out into your bloodstream. So the purple things are glucose, and then that insulin, I messed up. Let me see if I can pause this. Yeah, I can't. Okay, I got control of this thing now. So the insulin is going out into the bloodstream, and it's going to open doors on your cells. All right, so this is the receptor here for the insulin, and this is the door that it's going to open. And I don't know if this particular model shows it. So once you got all this glucose in your bloodstream and you sense it, all that insulin comes in with it. And then let's go to the next one. I'll show you what happens next. Now, here we go. So here's the insulin receptor here. The insulin has bound to the insulin receptor, and you notice it does like a twisty thing. Okay, this is an animation, but think of it as like a key on a lock on a door. Oh, crap. All right, so it unlocks the door. All of a sudden, the door opens. Now, all this glucose in the bloodstream is going to go right into the cell. All right, gets it out of your bloodstream. So the idea here is eventually your insulin just doesn't signal the cell to open the door so well. It's insulin resistant. So the sugar starts, once it gets really bad, no amount of insulin is going to do it. You basically have sugar hanging out at high levels in your bloodstream. Then that sugar gets converted into some toxic things like glucose can get converted into something called sorbitol. Sorbitol is, it's these sugar alcohols that can, or oxidized sugars that can become toxic to your nerves. They can blind you. Diabetes is the number one cause of blindness and of neuropathy. It's the most common type of neuropathy. It's toxic to your brain, So it's just, you end up, with dementia, either vascular dementia or Alzheimer's. It's not a good way to go. And it's totally preventable. And again, the trouble is getting off the sugar and carbs. If you know that you're one of those people like I was, that's just like, you feel like there is no way that I couldn't live without eating some sugar and carbs, every day, then give this a try and see what happens. See how much of that you can actually cut out of your life. After you've been on this 2 or 3 days, I'm telling you, you won't have those cravings for it anymore. Then you can adopt a lower carbohydrate intake and get rid of that sugar and carbs. And I'm telling you, I wish I would have had you as a professor of biology in college. Thank you. That's actually high honors. I really appreciate it. Is it okay to drink more than 1 ballance a day? Yes, you may. I drink 2 ballons per day personally, and I drink 2 Unimate per day. The protocol, the old protocol was 2 ballons a day and 1 of the tea, Unimate, and they reversed it. After Ben Bigman did some research on our product, he said 2 Unimate and 1 of the ballons per day, but I just drink 2 and 2. These are food supplements, so you can't get toxic on these. So that's good. The only thing is this got a little caffeine in it. So this is about the equivalent, I think, of a cup of coffee of caffeine in here. So you don't want to be drinking this too late in the day. I usually finish up my Unimate drinking about 2 o'clock. Okay. So one of the things you want to keep in mind with caffeine, by the way, and this is something a lot of people struggle with when they're trying to initially start to lose weight, is if they're not metabolically healthy, if you've been doing wrong and you know you've been doing wrong a long time, don't worry about that. But the deal is that your insulin levels are high, and this can cause your cortisol levels to be high. Now, cortisol is supposed to be high at the top of your day. Around 4 a.m. in the morning, your adrenal glands start putting out a bunch of cortisol. Okay. And it's a stress hormone. It's how you deal with stress. And you want that to be high at the top of your day, kind of get you ready to gear up and do your thing. You don't want it to be high at the end of your day. It stimulates you if you've got high cortisol at the end of your day. You want it to be high in the morning and sort of dwindling down over the course of the day. What happens is some people with insulin resistance it's kind of just stays sort of high all day and into the night. It's hard to get. It affects their sleep. Not to mention if you're overweight, you've got sleep apnea because you've got a lot of fat around your airways, which then blocks off your airway intermittently while you're trying to sleep. So you're in effect waking up a little every so often, multiple times during the night. So the cortisol is messing up your sleep. The sleep apnea on top of that is messing up your sleep. I mean, you're just constantly exhausted. So one of the things that I noticed right away when I got on this is that my sleep improved about 40%, like within just a month or two. The weight came off and my sleep got better. So I've been talking about this now for 2 years, and I'm never going to stop. It's a good product, and it's going to change the world. It already is for a lot of people. So it's going to hit that critical mass eventually, and Big Pharma is going to realize that they've got a problem. Like, this is a natural product that fixes all of those things. Here, I want to go back to that one slide. I want you to look at this now. This slide right here. All these diseases here. There's a bunch of different drugs to treat this one here. A whole nother set of bunch of drugs to treat this, and this, and this, and this, and this, and this. Each one of these is a lot of money for Big Pharma. It's a different set of drugs for each one of these things. This is why they don't want you to know about this, because this product cuts the head off of this Medusa right here. Notice this red part in here. That's the Medusa's head. You cut it off and you get rid of all the other stuff. It's gone. But if you just cut one snake off, well, you have 2 or 3 more snakes grow out, right? So if you cut the root out, which is what this product does, you get rid of all of them. That's the idea. JP's, your energy has increased so much since you started Unicity. Exactly my experience with that. I just noticed, here it is. It's 7:33 at night. I just got done. I'm 54 years old. I'll be 55 in April. I just got done running 4 miles out in 20-degree weather tonight. And now I'm here talking to you on this live. I got a lot of energy, but when it's time to go to bed, I'm good because my cortisol is going to be down. I'm ready to go to sleep. I can just sleep. But watch it with that caffeine. And even if you're not insulin resistant, drinking caffeine after 2 p.m. I hear a lot of people go, "It doesn't bug me. I can drink a cup of coffee and go right to bed." And I want to say, yeah. Not really. You think you are, but not really. I wake up looking forward to going to the gym. Yes. Got a new lease on life, JP. That's fantastic. And I do too. I'm telling you, this was a life changer for me. And it rolled back the clock on my body. What's in these old packets, the magic in this, the fiber, what happens is the fiber gets broken down into 3 things. It's 3 major, what they call short chain fatty acids. So one of them is acetate, another one is propionate, and another one is butyrate. And these things have really good positive effects on your body. not just on your metabolism, but on your psyche as well. They help raise your serotonin levels. I didn't know this until I started studying all this here recently, but 80% of your serotonin, the feel-good neurotransmitter, the anti-depression neurotransmitter, 80% of it is made in your guts. But it won't be made if you're feeding your guts a bunch of sugar and refined carbohydrates all the time. And it's made by a set of bacteria that feed on fiber. And once you start putting this into your belly, it's like putting a natural antidepressant indirectly into your body. And you just start feeling it. This is why they call it the feel great system, because it makes you feel happier. You feel great again. And so I just can't say enough good things about it. I really can't. Well, I think that's about all. 40 minutes is the cutoff for human attention. When meetings start going beyond 40 minutes, people start checking out mentally. We're at 36 minutes right now. So if anybody's got any questions, I'm happy to answer those right now. But if not, I'm going to wrap it up. I'll wait for 20 more seconds to see if there's any more questions. In the meantime, I'm going to look here to see if there's any thing about butyrate, short chain fatty acids. Here, I'm just to show you this. Short chain fatty acids. Here, I like to use ChatGPT. I want to see what it says. Has anybody used ChatGPT much yet? Let me ask it this question. What are the benefits of short chain fatty acids? Now, this is what that fiber gets broken down into. And it says it's good for gut health, anti-inflammatory effects, especially in the guts, regulates gut pH, discourages the growth of pathogenic bacteria. So it helps with the immune system, metabolic health, enhances glucose metabolism, thereby lowering your insulin levels, and stimulates the release of glucagon-like peptide, GLP-1. So it helps your body make its own GLP-1 rather than you having to inject it like all these people are doing with Wegovy and Ozempic. Those are artificial GLP-1s. This stuff makes you make your own. It regulates your appetite. Propionate is one of the short-chain fatty acids, and it's shown to act directly on your brain to make you less hungry. That's what I started noticing immediately on this product. After 2 days, suddenly I was like, something's going on, because I forgot to eat lunch, and I hadn't forgotten to eat lunch in like 20 years. I'm like usually like beating the door down, waiting at the hospital, waiting on the lunch lady to get the food out in the cafeteria. I'm like staring at her as she's slowly putting the food down into the kiosk thing there. And this time I totally forgot to eat lunch. I was like, I cannot believe I didn't realize it was lunchtime. That hadn't happened in decades. It reduces your fat accumulation, supports immunity. So, brain health, cardiovascular benefits, protection against chronic diseases, prevention of obesity, colorectal cancer, anti-diabetic, on and on and on and on. Okay. Hopefully you've gotten the message on this. You guys, I really enjoyed it. I'm going to wrap it up, and we'll do this again same time next Monday evening.